Many times I am asked by patients, how do I think this works? Over the approximately 4 years I've been doing this, I have come to some conclusions as to why I think this works, and I'm going to try to relay this in this PowerPoint. One thing you have to look at, which is at first not obvious, is that modern medicine has only been available to us for, in a true sense, about 100 years. Before that, we had many attempts at healing, and we learned from a lot of trial and error, but we really didn't have anything that worked as well as the body's own healing mechanisms. With the success I've had with subcutaneous injections of dextrose, which is simply a fuel. Dextrose is what every nerve in the body uses for its entire nutrition. I believe now I understand how you can take a pain that from an evolutionary standpoint the body is doing what it thinks is the right thing, and even with all the treatments we have in modern medicine, it is fighting this ancient adaptation. So it turns out this adaptation that works for all animals, not just people and fish and reptiles, is hardwired in us and is a maladaptation for modern times. So as we move forward, let us look at what happens in normal healing on the natural stage. The first thing that happens, here's your shoulder for instance, if you get a sprain or you were hit with a club back in the old days, you would get inflammation around the joint capsule, which would increase the amount of blood supply to that area, and that's typically shown on the body with swelling and increased warmth in the area. These inflamed areas make lots of nerves turn on, which makes it hurt to move, but it's trying to heal the injury. In olden days, especially, this time period could be closer to the 2 weeks. You'd basically get 3 days to 6 weeks where the body has a couple tears here in the tendon and is using nerves to keep you from moving it to try to fix it in place. This overall is a adaptive method, because if you were trying to heal from a hunting injury in the year 1000, you wouldn't want to give as much blood supply to this arm because you're not able to use it as it's healing and it hurts. So the body turns on some nerves here that makes it hard for you to move it while it tries to heal it. And therefore, by expending less energy, makes it far less likely that you will die from lack of food. This picture you would think you'd never see, but this is exactly what happens in societies that are still aboriginal, that do not have doctors. And you'll see that this area where the tendon was torn would be kept in place by those painful nerves and then turned into this thick, leathery area that could hardly move but would not hurt and would use much less energy. So within a short period of time, perhaps 6 weeks, for the next year, this would be getting tighter and tighter, and you would learn how to hunt better with your left arm because your right arm has no ability to move. And this would conserve energy for the body, again giving you the best chance of healing. The amazing thing that happens in the wild is the lowest energy state is for this to turn into bone, and that is the end point of natural healing. If you have a bad enough injury, that tendonitis will ossify, or that broken bone will ossify, and now you don't have the full mobility, but you have zero pain, and you have the best chance of survival. So the benefits here were that you needed a certain number of calories a day. At first, the area would get more calories to try to heal it, but if it doesn't work pretty quick, it remodels to a contracted position, limiting your energy needs. One can usually think of seeing a deer or a dog with their hind leg totally contracted up, and they are at that point no longer having pain and able to run around and still hunt and still make a living in the wild. You can imagine if instead they stayed at phase 1 and just kept inflamed and hurting, that the pain would be more of an impediment to their survival and reproduction than having the body contracted to a level of no pain. This, for example, is a fracture in an Aboriginal patient, and this person has a way better chance of survival in no pain than if this had stayed as a chronic pain. Now this again, here's a fellow who can't move his left shoulder, perfect for 2013 BC, but not perfect for now. And these type of disabilities are things that, because we have plenty of calories and all sorts of modalities, this person does not ossify. He remains in chronic pain. Even though he still has significant dysfunction, he doesn't get to the full limitation that would make this painless. So we basically have many, many soft tissue injuries that follow this mechanism that we don't, up till this time, have a mechanism to address. And this is something that we cannot change. So in our situation, we have no issue getting calories. This prolongs phase 1 healing, and we even can prolong it more with heat, massage, steroids, anti-inflammatory steroid shots, ultrasound laser, electrical stimulation, chiropractic, acupuncture, and we can sometimes get better, but oftentimes we don't, and we're just left with a pain that keeps recurring. Now, the mechanism of action of these modalities has always been said to be increased blood supply to the area, which I even have to admit, in 34 years of internal medicine, I would just share, well, it's bringing growth factors to the area, which seemed logical, though there wasn't any exact proof that that was happening. And this gets into the whole neurologic response to pain and substance P and all the inhibitions we have, and leads to medicines like non-steroidal anti-inflammatories, which decrease the prostaglandins and other forms of, this is a pain fiber, other ways to try to eliminate the pain. It can work at the spinal cord with drugs like Lyrica. But if you've got a really turned on peripheral nerve pain area, these modalities will not directly inhibit that. So when healing is slow, you stay in pain. You're told you have a tendonitis or tendinopathy. You're told you have a neuritis, and this can lead to adhesions, which are headed towards what the body wants, but you're going to fight that. People will go to surgery to have their adhesions broken under anesthesia, but all too often they recur. And a very rare patient, this is about maybe 1% of the chronic pains, suffer from the very severe syndrome called complex regional pain syndrome, which is beyond the scope of this discussion and has some different mechanism involved in it. So what pain does is inhibits your motion, inhibits your strength, and inhibits your ability to regenerate that area. And that decreased blood supply from the lack of motion and strength, if you don't use an area, the body doesn't give it a good blood supply, and the so-called growth factors don't come. So back in the olden days, it really was use it or lose it. And this control was done through the nervous system, not in what has been considered the main event, the brain or the spinal cord, but the pain is actually being controlled at the peripheral level. So we have animal models of this showing the endpoint of healing is contracture, and we even have some studies which I can show you a picture from that would say when you have a pain in a primate study, 50% of the pain receptors, the nociceptors, sharing the same innervation of the area of pain show increased activity. So while the whole area doesn't get increased activity, the areas of the nerves actually recruit. I call them sentinel nerves that are turned on to keep you from moving, and so they get some increased energy because they're doing their job to hold you in position, and the nerves next to them can be recruited by you're trying to use that area and causing a spreading lactic acidosis that burns and aches, which keeps you from moving. And this I can show you in the next slide that the increased metabolic activity of these nerves in the area creates a high energy need for those nerves that aren't going to get turned off unless somehow you can get enough blood supply to them, which I believe stops the local lactic acidosis, those pain receptors. And the way to get blood supply to them is to get food to them and not growth factors. And sentinel nerves evolved to create contracture. And in the old days, that worked fine. In the modern days, that just hurts like hell. So this shows a poor little animal who got injured on purpose, and then they show what happens when the animal starts using the extremity, and these green, red, and yellow areas show increased metabolic activity of the nerve. And one can see that if you move the extremity, the nerve gets a big increase in blood supply. I wouldn't say a big increase in blood supply, an increase in activity, which actually makes it secrete lactic acid bigger than the area that was injured. You can see it here. This is the area of injury. Red and yellow are even more activity, and it shows how this recruits the neighbors to say stop moving that injured extremity. So this recruitment of sentinel nerves that are already in a overdrive state leads to a spreading lactic acidosis, which makes you stop moving. And there are theories as what keeps this from healing. My feeling is it injects dextrose, which is the only thing that peripheral nerves use. This is absorbed within 2 minutes. There's studies that show that within 2 minutes of an injection of dextrose next to a nerve, that nerve will get its full complement of ATP, which is its energy source, and it reverses any local lactic acidosis. It may also even give some fuels to the injured cells in the area. Most importantly, very rapidly, the pain goes away, which leads to an increase in motion and a virtuous cycle which maintains a better blood supply and movement, and that keeps the nerve turned off, and now you're on the way to healing. And that, in a nutshell, is why we think this works. We'd like to show you a short movie regarding a case such as you may be suffering from now.